Welcome to our deep dive into Noneugenol Periodontal Packs, a modern solution in dental care designed for safety and strength. Today, we'll explore their composition, application, clinical outcomes, and patient instructions, all based on professional clinical guidelines. Whether you're a dental professional or a curious patient, understanding these packs can help you appreciate their role in post-surgical healing and oral protection. Let's start by examining what makes Noneugenol packs unique compared to traditional options and why they are increasingly preferred in clinical practice. Noneugenol periodontal packs are formulated through a reaction between metallic oxides and fatty acids. The supply typically comes in two tubes, one containing the base and the other the catalyst. Tube 1 holds zinc oxide, plasticizing oil, cohesive gum, and lorothiodol, a fungicide. Tube 2 contains coconut fatty acids, rosin, and chlorothymol, which acts as a bacteriostatic agent. This dual tube system ensures a controlled and effective mix, providing both mechanical strength and antimicrobial protection. Alternatives like cyanoacrylates and methacrylic gels are also available, but Noneugenol packs stand out for their safety and performance. The first tube, known as the base, is packed with essential ingredients for structural integrity and antimicrobial action. Zinc oxide provides the main bulk and strength, while plasticizing oil ensures flexibility. Cohesive gum helps the material stick together, and lorothiodol acts as a fungicide, preventing fungal growth in the healing area. This combination is carefully balanced to maximize both mechanical and biological benefits, making the base tube a cornerstone of Noneugenol periodontal packs. The second tube contains the catalyst, which activates the base and adds further protective properties. Coconut fatty acids are included for their gentle, natural origin and compatibility with oral tissues. Rosin helps with the setting and stability of the pack, while chlorothymol serves as a bacteriostatic agent, inhibiting bacterial growth. This tube is essential for completing the reaction and ensuring the pack is both effective and safe for patients. While Noneugenol packs are widely used, alternatives such as cyanoacrylates and methacrylic gels are available. Cyanoacrylates offer rapid setting and strong adhesion, while methacrylic gels provide flexibility and ease of application. However, these alternatives may not match the safety profile and fracture strength of Noneugenol packs, which are free from asbestos and eugenol, making them a safer choice for most patients. Non-eugenol periodontal packs rely on mechanical interlocking for retention. The material is pressed into the interdental spaces, creating a secure fit that holds the pack in place. Additionally, the facial and lingual portions are joined, further stabilizing the pack. This mechanical retention ensures the pack remains effective throughout the healing period, providing continuous protection and support to the surgical site. One of the key advantages of Noneugenol packs is their safety profile. Unlike traditional eugenol packs, they do not contain asbestos or eugenol, substances associated with allergic reactions and toxicity. Additionally, Noneugenol packs offer higher fracture strength, making them more durable during the healing process. These benefits contribute to their growing popularity among dental professionals and patients alike. To prepare a Noneugenol periodontal pack, equal lengths from both tubes are dispensed and mixed until a uniform color is achieved. This ensures the chemical reaction is complete and the material is ready for application. The mixing process is straightforward, but attention to detail is crucial for optimal performance. Once mixed, the pack is conditioned in room temperature water for 2 to 3 minutes, allowing it to reach the desired consistency. After mixing, the pack is conditioned in room temperature water for 2 to 3 minutes. This step is vital for achieving the correct texture and tackiness. The pack is ready for placement when it is tacky-free, meaning it will not stick to gloves or instruments. Proper conditioning ensures the pack is comfortable for the patient and effective in protecting the surgical site. Placement involves forming 2 strips, one for the buccal cheek side, and one for the lingual or palatal tongue side. These strips are joined by hooking around the distalmost tooth and applying interproximal pressure. This technique ensures the pack is securely anchored and provides comprehensive coverage of the surgical area. The pack remains in place for about 1 week, offering continuous protection during the critical healing phase. Once placed, the Noneugenol Periodontal Pack is typically left in position for 1 week. This duration allows for optimal healing and protection of the surgical site. During this period, the pack acts as a barrier against food debris, bacteria, and mechanical irritation, supporting the regeneration of oral tissues. After removal of the pack, clinical findings vary depending on the surgical procedure. Following gingivectomy, a new epithelial meshwork forms, indicating healthy regeneration. After flap operations, the area is epithelialized but remains fragile, so probing should be avoided. If calculus removal is incomplete, persistent red granular tissue may be present and should be removed with a curette. Food debris, often grayish or white, can be gently wiped away with moist cotton. These findings guide post-operative care and ensure optimal healing. Patients are advised to keep the pack in place for 1 week and take prescribed medications as directed. This ensures the pack remains effective and supports healing. Adhering to these instructions minimizes complications and promotes a smooth recovery. Patients should also be aware of specific dietary and care recommendations to further protect the surgical site. Patients should avoid hot foods for at least 3 hours after surgery and steer clear of citrus, spicy foods, and chewing on the treated side. Brushing over the pack is not recommended. Instead, use ice on the first day to reduce swelling. These dietary and care instructions help maintain the integrity of the pack and support healing. Patients may resume normal activities but should avoid exertion and refrain from smoking. Mild bleeding and saliva is normal for 4 to 5 hours post-surgery, but heavy bleeding should be reported immediately. These guidelines help ensure a safe recovery and minimize risks associated with post-operative complications.